Hello and welcome. LO6. Understand the context for the use of physical intervention and restraint. How can physical intervention and restraint be safely managed in residential childcare? Understanding the context is essential to protect children, safeguard staff, and maintain a safe, supportive environment. In this video, we will explore the key principles, legal and ethical considerations, and best practices that help ensure safety, dignity, and trust for everyone involved. Physical intervention is any contact used to guide, block, or prevent harm. Restraint is more serious, restricting movement to prevent harm. It's high risk and must be used only when necessary. The context is always safety, not control or punishment. Understanding this is vital for emotional and physical safety. Restraint is used when there's immediate risk, like physical assault or self-harm. It should never happen without risk of harm. The goal is to protect, not punish or gain compliance. Safety is the priority, with restraint as the last resort. Understanding this context helps prevent misuse. Restraint carries risks like injury, fear, and damaged relationships. It can escalate trauma responses in children with abuse histories. Even lawful restraint can feel like past trauma. Thus, restraint must be minimal and followed by repair. Understanding risks helps protect children's well-being. Children in care may respond to stress with fight, flight, or freeze. Restraint can worsen these responses, triggering panic or numbness. Staff must be trauma-informed and focus on prevention. Early recognition of triggers is crucial. Minimizing restraint protects emotional well-being. Restraint must be necessary, proportionate, and reasonable. It's the least restrictive option, used as a last resort. Ethically, it respects the child's dignity and rights. It must never be punitive or out of frustration. Understanding these principles ensures lawful and ethical practice. A positive relationship policy reduces restraint by building trust and communication. Early de-escalation and consistent boundaries are key. Emotional regulation support and restorative repair help prevent incidents. When children trust staff, they're more likely to accept guidance. This reduces the need for restraint. Restraint should never be standard, it must be individualized. Behavior support plans and risk assessments are crucial. Knowing triggers and calming strategies helps. Health risks must be considered. Good planning reduces the frequency and predictability of restraint. Restraint doesn't end with the hold. Support afterwards is vital. Check for injuries and provide emotional support. Staff should debrief and reflect on the incident. The child should share their view, and restorative repair should occur. Proper records and management reviews prevent repetition. Restraint is a last resort after all non-physical strategies fail. It must be necessary to prevent harm and proportionate to the risk. The least restrictive option should always be chosen. Respect for the child's rights and dignity is crucial. Only trained staff should carry out restraint. Child development affects behavior and emotional regulation. Younger children may lack coping strategies, while teenagers may struggle with regulation. Trauma can delay emotional development. Understanding these factors helps prevent escalation. Better understanding reduces the need for restraint. Children with communication difficulties may express distress through behavior. Understanding these needs helps staff adapt instructions and reduce demands. This reduces the likelihood of physical intervention. Recognizing communication needs is key to de-escalation. It ensures safer, more effective responses. The culture of a setting affects restraint use. A calm, predictable culture reduces incidents. Consistent routines and respectful communication are vital. In contrast, inconsistent cultures increase restraint. A supportive culture lowers crisis points and restraint frequency. Staff attitudes shape interactions and escalation. Supportive attitudes reduce restraint by focusing on communication. Punitive attitudes increase conflict and restraint risk. Understanding behavior as communication is key. Early intervention prevents dangerous escalation. Teaching empathy, respect, and communication reduces restraint. Children learn to express anger safely and accept boundaries. This prevents behaviors leading to restraint, like violence. Social awareness reduces risks before crisis point. It supports safer, more positive environments. Peer dynamics in residential homes affect restraint levels. Positive peer culture reduces bullying and intimidation. It creates a safer, calmer environment. Negative peer culture increases conflict and restraint. Managing peer culture is crucial for reducing restraint use. Strong teamwork and consistency reduce restraint. Shared approaches and planning prevent escalation. Poor teamwork increases restraint risk. Consistent boundaries and support are vital. Early intervention by a cohesive team lowers crisis incidents. Leadership influences restraint use significantly. Good leaders promote trauma-informed practices. They ensure staff training and review incidents for learning. Weak leadership leads to inconsistent practice and higher restraint. Strong management supports safer, more effective environments. Restraint training must meet legal and ethical standards. It should focus on prevention and de-escalation. Staff competence must be assessed, not assumed. Ongoing training and compliance checks are crucial. These ensure restraint remains a last resort. This supports better outcomes for children and staff. Thank you for your attention. If you need any further information, please contact us on 074-8436-1688 or email the UK Versity team.